Hello friends, you know what is the most disabling orthopedic problem for old age? If you see around, the most of the people who has difficulty in walking, difficulty in doing day-to-day activities, most of them are suffering from knee pain. And most common cause of knee pain in old age, even in before 60 like 55, 56 is, yes, you guessed it right, it's a osteoarthritis. So today we are going to talk about osteoarthritis, what it is, how does it affect, and how we can make a diagnosis of osteoarthritis based on X-ray findings. But before that, we need to understand how to see normal knee X-ray. So if we talk about normal knee X-ray, we first need to see how does it look like a normal knee X-ray. This is a thigh bone, as we all know. It's a tibia. This one is fibula. Okay, so now this is a knee joint. Here you can see it's a lateral condyle of femur, it's a medial condyle of femur, and it's intercondylar notch. Now, if you talk about tibia, it's a medial condyle here, and then this is a lateral condyle of tibia. Okay, as you can see here, this spike is medial tibial spine, and this is a lateral tibial spine. So now you can see this is a lateral compartment of knee, and this is medial compartment of knee. Now, this is a normal anatomy of knee in AP X-ray. Now if we talk about lateral X-ray, here you can see this is a thigh, this is a shaft of femur, this is distal femur, medial and lateral condyle of femur, this is a patella, and this is a proximal tibia. So this is a proximal tibia posterior loop. So this is a lateral X-ray of knee normally. Now, so as you can see here, there is a black gap in between the femur and tibia. What is that? This radiolucent area is because of two things. First one is a cartilage covering over the distal femur and distal tibia, and second one is a soft tissue in between this bone. Okay, now if you can see this knee model here, and if you talk about AP view, as you can see, it's a patella, it's a quadriceps tendon, it's a patellar tendon, it's a fibula tibia, it's a medial collateral ligament, it's a lateral collateral ligament. Now if you compare this X-ray, so here you can see the gap between the tibia and femur. This space is occupied by two things here. This one blue structure, that is meniscus, and the pollis of distal femur, that is cartilage. So cartilage and meniscus creates the gap between these two bones. That is why the gap of these two compartments, medial and lateral compartment, is created by distal femur, cartilage, meniscus, lateral and medial, and proximal tibial cartilage. And it creates two compartments, medial and lateral. This is a medial compartment and lateral compartment. If you can see here from behind, this knee has a posterior cruciate ligament, and this is a meniscofemoral ligaments. Okay, so this is a lateral view of this model, where you can see this is a distal femur, this is a proximal tibia, and this is a lateral meniscus. Now, what happens when arthritis develops? As you can see here, is a KL classification of osteoarthritis. This one is a normal knee, where you can see the medial and lateral gaps are almost equal, and then the gradually joint space of medial femoral condyle and medial proximal tibial condyle space is getting reduced. A bit of it, and then gradually more of it, and then more and more of this. So gradually the space is getting reduced, and finally it is gone in a severe osteoarthritis. So grade 1, grade 2, grade 3, and grade 4. So joint space reduction is a pathognomic feature of osteoarthritis. The second important thing is you can see the sclerosis of proximal tibia. This bone is getting bit sclerosis. The hard bone is getting formed at the surface of the tibia and fibula, where the both bone rub between each other due to lack of these structures. So meniscus is gone, the cartilage is gone, now the bone is rubbing to each other, which leads to sclerosis of the proximal tibia and distal tibia articular surfaces. That is what is osteoarthritis. So this is arthritic changes. How far it can progress? If you can see here, this is a normal knee with the equal median and lateral joint space is normal in this X-ray, and then here the joint space got reduced on medial side. That is a grade 4 osteoarthritis. And then if the process of osteoarthritis has not been stopped, then what is going to happen? That the joint is going to subluxate. So there is a bit of subluxation of joint, and which further going to subluxate a various subluxation. So these type of knees, this is how a normal joint can progress into severe osteoarthritis changes, then severe osteoarthritis changes with the deformity and severe deformity. That is progression of osteoarthritis. As now we know how to read normal knee X-ray, how to identify the medial and lateral compartment of the knee joint, and then how to identify osteoarthritis. It's grading from mild, moderate, severe to very deformed knee. So after knowing this, I'm going to show you one of my case where I did total knee replacement for severe osteoarthritic changes of his right knee. Okay, so this was her pre-op X-ray, and this was the deformity for which she was having difficulty. So she was not able to put 50 or 100 steps, not more than that. So she was just able to move confined to his house. Doing his household activities were getting very difficult. So we went forward to do the knee replacement. This was his. We prepared the knee before the surgery, and we painted and draped it, and then we did the incision, the typical midline incision. Then we opened the joint with medial parapatellar approach, and then we did femoral cuts with the intramedullary jig, and then with the proximal cuts, and then getting all these chamfer cuts and distal femoral cuts and anterior femoral cuts for femur to develop a particular shape of distal femur shape for his articulation. And then the preparation of knee and putting the joint inside, and then getting the final fixation of the joint. Okay, finally this is the post-op X-ray of the patient, and where we have corrected the deformity, and we have now able to maintain the equal joint space medially and laterally, almost equal joint space medially and laterally, to give her natural knee. It's not 100% natural, but it is quite better than what she had before. So I hope you like this, and see you very soon. Bye bye.